I'm Dr. Signe Goldman. I'm a psychiatrist, and I've been practicing psychedelic psychotherapy for many years. And I currently teach a training program in ketamine-assisted psychotherapy through the Living Medicine Institute. So I'm often asked, how does one get into this field or this type of work? How do I become a psychedelic-assisted psychotherapist? And so I'm going to talk a little bit about the way that I answer that and what I think the answer is. And then I'll talk a little bit about how this series of videos may fit in with that for some of you. So the way that I answer this question is not always what people want to hear. But I feel that it's really important for me to be honest based on my experience about what makes someone good at this and where you need to be in your sort of professional development to take on this goal of working with people in altered states. So without further ado, I think step one to being a good psychedelic-assisted psychotherapist is be a good therapist. I know that this sounds like it goes without saying, but if you are an early career therapist, or if you're someone coming from a related profession but you haven't done a lot of actual psychotherapy yet, then I would strongly encourage you to spend a few years doing full-time therapy for a living and feel like you really get proficient in and confident in your skill set as a therapist. A huge percent, maybe 80 or 90% of the change work that a client goes through in a psychedelic-assisted psychotherapy context or clinic is done in integration or preparation, or is done in, frankly, the sober state. So you have to really have a strong skill set as a therapist and feel that you're sure that you can handle what comes up or any content that comes up for people, and that you know that you can deal with challenging material, and that you have a toolbox of skills that you already feel comfortable using when you are in the room with the client, whether they're in an altered state or not. So this is a foundational piece, and I mention it up front because I know from experience that some of you who are wanting to ask that question are early career therapists. There's a lot of information out right now about doing psychedelic therapy, and a lot of people are increasingly interested in it. And if it feels like it's calling you and this is what you want to do with your work life or your profession, then that's amazing. And I think you should follow that impulse. But I do think that you should spend a little bit of time making sure that you're a skilled therapist before you begin working with people in altered states. We hear a lot about the psychedelic state as healing and transformative and beautiful. And all those things are true. But it is also true that it can be damaging. You can harm people if it's done badly or done in a harmful way. So please know that we have to take seriously the responsibility of making sure we're adequately skilled and trained before we put people in the vulnerable position of being in an altered state in a room with us when we're not adequately prepared to hold that. So be a good therapist. Some of you I know are coming from fields where you are not directly practicing psychotherapy in a formal sense. For example, I often have in my trainings people who have a lot of experience as underground providers. So holding circles or working, doing medicine work with people on the underground or in a non-formal, non-clinical setting context. Often these are some amazing trainees with amazing skill sets. So this is actually really a positive. That skill set will serve you really well. But you will also want some sort of formal training in psychotherapy, because a huge part of this work is what's called preparation and integration, which is really therapy. It's psychotherapy, working with the content that the altered state produces. So again, I think for those of you who are in that situation, I would encourage you to get some formal training as a psychotherapist if your intention is to do this kind of work. So step one, be a good therapist. Step two is, if you are already a therapist, consider increasing your skill set in working with two particular domains if you do not already have this. One is transpersonal work, I'm not going to dictate a particular school or style of therapy, but have some ability to know what to do with transpersonal content when it comes up for people. People are going to have experiences that are existential or spiritual to them, and have some experience with knowing how to work with that with people. And then the second is somatic. It's really important with people in altered states that if they have a lot of somatic symptoms coming up, that you know how to hold that in a healthy way, or that you know how to work with that if the session's going that way and that's what the client needs, even if they're not naming it. You need to just have that available to you. And we'll talk more about that in detail if you continue on with the didactic part of the training. So some experience with transpersonal work and some with somatic. Okay, step 2, this is a big one, is have experience yourself in altered states. I cannot emphasize this enough. I know that there is a lot of push right now to train people as psychedelic therapists, and it's increasingly possible to be considered trained when you've had 1 or maybe 2 sessions of a medicine, possibly even in a somewhat narrow context. I feel really strongly that you cannot do this work well unless you have a lot of experience on altered states yourself. You need to know what it is to be altered, and you need to know how to navigate that landscape a bit, the different ways that can show up, the different ways it can feel and look, so that you can intuitively understand what's going on with the client. And again, this may seem somewhat obvious, but I think it's really important to emphasize. I don't think it's always being adhered to with people who are intending to train in this field. I frankly consider it irresponsible to sit with someone as a therapist when that client is in an altered state and you have not done that enough yourself to really understand what's happening with them. And yet you are purporting to be the guide or to be helping them do healing work in that state. So find a way to have a lot of experience, as much as you can, in an altered state yourself, if what you want to do as a profession is to guide others in altered states. Ideally, you get a lot of experience with whatever medicine you intend to use with your clients. Nowadays, ketamine is the most accessible and legally available medicine, psychedelic medicine in clinical use. So that may be ketamine. In my training program, it certainly is. But if ketamine is what you're going to use with your clients, then certainly you need to spend a lot of time in that state yourself. Okay, so we have be a good therapist with some somatic and transpersonal background or understanding. And then we have spend a lot of time in altered states yourself so that you know what that is. The next piece that I think is a prerequisite for getting trained in this work is what I would paraphrase as do your own work. And what I mean by that is, again, we're working with people in altered states who are often vulnerable, and it's really important that you're at a place in your personal life and your career trajectory where you have looked at your own shadow content, your own hurdles, your own edges, your own trauma patterns, where you're pretty sure that your stuff isn't going to come up in the room in a way that's going to be detrimental to your client. So if you're still struggling, or if you've still got those rough edges where you're easily triggered, or other things like that that come up from you, I would find it really valuable to do your own therapy work and have the supervision or mentoring around that. That does not mean that you cannot do this work. It actually means that you will do this work better. Because we're all human beings and we all have those edges, we all have our shadow. And to do this work in a good way, we need to know ourselves well enough to know what that is and to know how to encounter that when it comes up and how to make sure that that's not interfering with the work we're doing with our clients. So, do your own work. So if you are a good therapist and you've got those transpersonal and somatic understandings, that isn't totally unknown to you, you have spent some time in altered states, or that's you have a sense of what that is and who you are in that space, and you have done your own work, then I think you're ready to get trained as a psychedelic-assisted psychotherapist and to start seeing clients. And the last piece that's left to you is what I would call sort of a specific training in psychedelic therapy, like the one that we offer. And there are others out there as well, where you specifically learn the skill sets to work with a particular medicine. So given all of that context, I'll tell you a little bit about the training program that we offer through the Living Medicine Institute. It's designed a little differently than a lot are, and I'll tell you why. And then we'll talk a little bit about how this series of videos fits into that context. So I have learned from experience over time when working with cohorts of trainees to put the experiential component first. I know a lot of trainings out there do not do that, but I feel strongly that if you are going to work with a medicine, and in this case it's ketamine, before learning about it in a didactic sense, you need to spend a lot of time in the ketamine space, so to speak. You need to know what it feels like to be on ketamine and what some people would describe as developing a relationship with that medicine. Really learning what it feels like and what it is to be in that state, the different ways that can look. And so we choose to give our trainees a lot of ketamine experiences right up front in the training program. If you are exposed to the altered state, like ketamine sessions yourself, and some things come up that you're not so comfortable with, or you're not sure about, or it doesn't feel quite right to you, then that's important to know in the beginning, because that may be a conversation to have around like where you need to go next, or what does this mean for you. So I really think that the first thing is to figure out your relationship with that medicine and your comfort level yourself navigating that medicine. And if you come out of those experiences feeling like, yes, this is for me, I get this, like this sort of calls to me, then it makes sense to move into the didactics at that point and really start learning the skill sets in a sort of academic way. So that would be the second piece of the training that we offer, is what I call the didactic component. And following that, we assign our trainees cases to see under supervision through our clinic. So when you graduate training, you should have had multiple experiences with ketamine yourself, a series of didactic lectures or components, and then you should have seen at least 3 clients supervised through the preparation, the actual medicine sessions, and the integration phase, so that you feel confident that you know what this work looks like, you have already experienced it, you've already worked with clients, and you have some sense of like what it actually feels like in the room. And people feel quite prepared coming out of that combination and that sequence. So on a practical level, our experiential component at the Living Medicine Institute, we provide 8 experiential sessions for clients, 2 IV in different doses, 2 intramuscular or IM in different doses, 2 lozenge or troche experiences, and 2 with nasal spray. All of these done in varying contexts and varying routes of administration, varying doses, so that you have a good sense at the end of that of the broad array of types of experience that a person can have from ketamine. And so you feel like you have a pretty nuanced and understanding of ketamine coming out of that. And then we go into didactics, and then we have people working with clients themselves and supervise through that. So this series of videos is an initiative of taking the didactic component that I've taught over time and putting it in video format. So that's how this piece sort of fits into the puzzle of your overall development as a psychedelic-assisted psychotherapist. You do need to be ready to start training with all those things I talked about earlier. And if you are starting a training program, whether it be ours or whether you intend to use these videos for your own, intellectual growth around the didactic part, you will also need to do the experiential part and the supervision part in some capacity, whether you can find that through a mentor or a supervisor local to you, and so on. So that's a little bit about what we're doing with this video series. And the next video, I'll talk a little bit more about myself as a teacher so that you have a little bit of a sense of what my background and influences have been, because I'm sure that that also influences the way that I teach. So thank you all, and I look forward to talking to you in the next video.